Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today we have two guests, which is a little different, and I really like it, so this will be fun. Today's guests are Dr. Sherie Friedrich, who is the Chief Psychology Officer at MediTelecare, and Stephen Tipping, who's the Vice President of Operations. How are you both doing today?
Doing great. Thanks so much for having us.
Yeah, doing great, Jared. Thanks for having us.
Perfect. I'm really excited to have both of you. I think we should start rolling. Let's start with, I guess, Dr. Friedrich. I'd love you to give the audience a quick 1-2 minute snapshot of your background, and then Stephen, if you could do the same thing, that'd be great.
Great. So I am a clinical psychologist by training and the Chief Psychology Officer here at MediTely. My background is in lifespan development, and my interests really fall with working with the geriatric population, providing services and leading a team of clinicians performing psychological testing, assessments, and individual therapy services, as well as working with families of aging patients who live in the community as well as in skilled nursing facilities.
Great. I'm Stephen Tipping. I'm the VP of Operations with MediTelecare. My background, my education is in occupational therapy. I did that for many decades in the therapy world. And I came to behavioral health because I was always passionate as a therapist about behavioral health, not just the physical part of therapy, but also the mental capacity. And I saw a great need in our community, and I'm happy to be aboard with MediTelecare. I oversee our operations in New England currently, and am in charge of the operations as we launch this new platform for the community.
Thanks both of you for the quick intros. Appreciate it. And just so the audience knows, this is like an ongoing, we talk with members of the MediTelecare team. Ed's been on a couple of times, and he's really given us a good overview of really what you're trying to build over there, what you're continuing to do, your growth. And then on the last episode, we talked a little bit about the launch of MediTely. And I want this podcast episode to focus a little more into that. So I'd appreciate if one of you could tell us more about the project, also why you decided to launch it, if you can. And then we can also go into some other areas that kind of trickle down from that topic.
Yeah, so MediTely is a new project, new service line that we are really passionate and excited about growing. MediTely really evolved during the pandemic when we saw a greater need for access to behavioral health care amongst a number of populations. First off, the aging population, that's what we specialize in, working with older adults. And so we were finding that we were getting a lot of requests to provide outpatient ambulatory services to older adults who we had previously only treated in the long-term care sector. Additionally, there had been increased interest in nursing staff and medical providers who were working on the front lines during the pandemic and found themselves wanting their own behavioral health and support. So we really developed MediTely in response to the needs of those populations. Additionally, families were finding themselves really isolated from loved ones in facilities. And so through the technology we use at MediTely, we've been able to start to introduce service lines to families who have, as you probably know, been really struggling this past year as they've been isolated from their loved ones. Stephen, do you talk a little bit about the technology and about how people can access MediTely in a telehealth environment?
Sure. Our app is either you can log on to meditely.com, or you can download it on the Apple or Google Play Store, and you can log on and sign up. And we have a customer service rep that can get back to you within the day and get you started with our platform. And it's, as Sherie said, it's community based, but it's also for our existing long-term care customers. So we're super excited about this.
So I did see it in the App Store too, and I think it's in Android too as well.
It is Google Play. Yep, Google Play. Yes, cool. Absolutely.
It's always nice to see both. It's a rarity now when you see someone only doing one, but I I mean, I'm a big Apple guy, but I know there's people that also leverage Android, and that's great that you included it in both. Can we talk a little bit about? I think this was one of the things that we wanted to kind of dive into, right? Was access to the topic of access to care, which is obviously one of the big important. Let's call it. A lot of people actually name it like a moonshot, right? Like how do we continue to improve access to care? Can you talk us through a little bit how MediTely helps like improve access to care?
Well, there's a number of ways that we improve access to care. I mean, first is just utilization of telehealth technology. That's huge right now. There's a shortage of mental health providers nationwide, and that problem even worsens when we're talking about caring for aging adults. A lot of people in the fields of psychology and psychiatry sort of cap their area of expertise at the age of 65. So we eliminate an entire population from receiving services. So telehealth allows not only the patient to easily access care, they don't have to worry about transportation, they don't have to worry about, burdening family members with driving them for visits, no long waits. They can just, reach out to providers from the comfort of their home. So that's one way that we really target access to care. The other thing that's so important, though, is that we're able to really have a great team of clinical providers who are skilled at treating aging adults, and with telehealth are able to do so without geographic boundaries. So no longer do we have to, find somebody who's working and living in a certain radius. We can really reach out to our network of providers across the country to then have easier access to care and less of a wait before that first visit that's so critical.
Appreciate that. Stephen, is there anything before we jump over to the next topic that you want to add to that?
No, I think Sherie hit pretty much all of our points and kind of why we thought this was a great opportunity for the community. I think the only thing I would add is it also gives the community the ability to access behavioral health via telehealth in what I would consider quote unquote non-business hours. So, if you go to a physician's office, they might only be open certain hours that A, doesn't work for the patient, or B, they can't find family to transport them during that time because they're busy with their own lives or their own job. So this gives a little bit more flexibility for people in the community to access the necessary behavioral health that they need and deserve.
That's a great point. Jared, do you mind if I jump in and add something?
No, please add more.
One of the things that's really unique about our services in terms of access is also our care coordinated model. So there's a lot of telehealth services out there right now, and that's really boomed, obviously, throughout the pandemic. But we have found for the patients that we're really treating and working with, they do need high touch. They need somebody on the other end of the technology to help them. This may be their first telehealth experience, their first time seeking care in this way, the first time using the technology in this capacity. So our care coordinated model puts a lot of resources in place behind the scenes so that the person doesn't become overly burdened or frustrated with the technology, but can actually reach a human being that coaches them through, that actually is there at the time of their first appointment to link them with the provider and make sure everything runs smoothly. So I think that really improves our access when we are, working with a population that might find this approach to treatment really novel and could otherwise become easily frustrated and sort of give up.
Great point. It's definitely something that I really enjoy about our platform. A lot of people struggle with technology, and us having that ability to help them navigate it is going to help decrease their stress and anxiety. For many people, they're coming to our platform because of stress and anxiety. We don't want to add to it. So it's really a benefit of what we do, and I think we do it well.
What's next in terms for MediTely? So this was how soon was this launch? This was not too long ago, right? The launch of MediTely?
No, we've been doing the work behind the scenes for the past year. It's only been a few months since we've released our first version of the app and have our browser base fully operating.
Okay. All right, so you're still, yeah, you're still in those early stages of the app. Although like you just mentioned, right, it's not like, even though you just launched it a couple months ago, it's been a work in progress for, about a year now, which anyone who understands software products knows that that's actually really good that you were able to get out that product in that time period. What's next though in terms of the platform? Are there any like updates that you foresee in the near future, or anything else that you can comment on, kind of where MediTely is heading?
Sure. Do you want me to take this, Sherie?
Yeah, go ahead and I'll jump in.
Yeah, so I think the next logical step for our platform, our app, in our ambulatory services is the transition of care. So we're going to be able to use this with our existing business, our long-term care facilities, our skilled nursing facilities, our assisted livings, and be able to offer the facilities and the patients in those buildings the opportunity to continue their behavioral health services with us when they get discharged back to the community. There's such a need, and there's so much anxiety on the facility side when they take a patient and they are looking to discharge them back to the community, finding the necessary behavioral health services and coordinating that. Sometimes it holds up the discharge. And that's the last thing anybody wants. The facility doesn't want that, and the patients don't want that, right? The patients are looking to get out as soon as possible. So we're really happy to be being able to partner with our current facilities and offer this as a way to offer behavioral health to the individuals being discharged back into the community. It also allows the patients, when they're discharged back, there's times when they wait up to 9 months for an appointment, or greater, if there's a shortage of behavioral health in their region. Where our goal is, we're going to have that continuity of services. They're used to something in the facility during their stay, and we're going to be able to offer that immediately when they get discharged. It's exciting. I think our facilities, it's going to be a real value add for them. I think it's going to help take the burden off their discharge planning. I think it's going to help their admissions process, where they might be able to take patients that they may not have taken before because they're thinking discharge, and the struggles it is to find community-based behavioral health. I think it's going to help the facilities and the patients with decrease hospitalizations and what I would consider unnecessary ER visits, because we're giving them that access to behavioral health immediately. I think the patients are going to like the continuity of care, that they're going to know that someone's following up with them very shortly after discharge. It gives them a softer landing, because we're all readjusting no matter whenever we make a change in our life. So they're making an adjustment when they go from community to long-term care and long-term care to the community. So giving that softer landing and helping them through that transition is very beneficial to the patient. It's like we said, no delay in services. There'll be no waiting period, or hoping my insurance takes this, or hoping that this person can fit me in. And then, a lot of people get discharged to the community with home health care. And part of the regulations for home health care is that they have to be homebound. They can't leave to do things, technically they shouldn't be leaving for appointments. So this gives us the ability to do the behavioral health in their home virtually, with a much better time for them, what works for them. So it definitely is a benefit for the patient. And lastly, for MediTelecare and MediTely, our mission is to consistently give people access to world-class clinicians that will help improve their quality of life. And I do believe this is the next step for us. This platform is going to allow us to deliver that next step. We do it so well in long-term care. Now we're going to be able to follow these people in the community, and it's really, really going to be groundbreaking for us.
Thank you for that, Stephen. Had myself on mute for a second, and I wanted to talk, and I was like, someone was holding me back. So yeah, I really appreciate that. And I appreciate both of you coming on. And I doubt this will be the last time you actually end up coming on the podcast, right? We'll put together some other episodes and some good content together. And I look forward to continuing to hear the story of what MediTelecare is doing, but also how things are going with MediTely, and how that's allowing you to continue to execute upon your grand vision, right? So thank you both for joining me on the podcast today, and look forward to having you back on soon.
Anytime,
Thank you so
Jared.
much,
Thank you so
Jared.
much.